Professor Stephen Friedman, just to look at whether or not the media has been asking the right questions regarding the COVID-19 pandemic, or has it been an unwitting government mouthpiece when it comes to its reporting. Professor, thank you so much. It's always a pleasure to talk to you. How have we been doing as the media during this pandemic? Have we been a government mouthpiece?
Thank you. Well, I'm sure you haven't been a deliberate government mouthpiece, but it has worked out that way. And the reason it has worked out that way is that the key questions have never been asked. I make the point in an article I wrote about that. I obviously can't listen to and watch all media all the time, but I do listen and watch a lot. I have never heard anybody personally on media in this country ask any critical question at all of any medical scientist. Not one, even when what they say is clearly wrong. So when Professor Gray said that she'd never encountered, that there'd been no malnutrition cases at Baragwanath before the lockdown, that was allowed to stand until she corrected it herself. When all the scientists say that a large number of illnesses are inevitable, that has never been questioned, despite the fact that it's not inevitable. Rwanda has had less cases since March than we have in a day. Rwanda has had 1/10. It's at about 1,500 cases. We have about 10,000 in a day. So we've never heard any questioning of the medical scientists of why they say it's inevitable if it's not inevitable in Rwanda or in Kerala in India or a lot of other places I could name. I think also the questions that haven't been asked, two key questions, is one of the reasons why we have the very high levels of illness we have in this country at the moment is because the testing program failed. It didn't do what it was supposed to do. It didn't identify the contents of people who were ill and isolate them so that they didn't spread the virus. Now, we've had very little questioning from the media of what happened with testing and why it went wrong. The final point is that we continually get told that all that was going on was that we were getting the health system ready. The problem with getting the health system ready is that there's no cure for COVID-19. So if you say you're getting the health system ready, then you have to say what it is that helps people by going into the health system. Now, once again, I haven't heard any questioning about that. Nobody said, are people getting better in hospital? Are people being cured? Are people, because we got the hospitals ready, are people being restored to health and restored to their families rather than remaining ill? Now, unfortunately, if you don't ask any of these questions, then you don't get to the bottom of it. And where there have been critical questions, they've all been about the restrictions. Why do we have this restriction? Why do we have that restriction? Now, you can ask those questions. The problem is that the evidence shows very strongly that we're not going to have a healthy economy in this country until we fix the virus. You can open up as much as you like, but most people are not going to go to entertainment events or things of that sort if they're worried that they'll get a dreadful disease. So until we actually start bringing this virus under control, we're not going to get our economy back, and we're not going to get a decent lifestyle back. And so in my view, those are the questions that should have been asked. What are we doing to actually make sure that we can beat this virus? And I'm afraid in the main, there are obviously exceptions always, but in the main, those questions haven't even been on the table.
And Professor Friedman, there's been concerns around the shrinking newsrooms, particularly, worsened by COVID-19, as we have seen the closure of some of the titles there. Some have argued, though, that a smaller newsroom means less good reporting, because you then have to feed the beast of the growing cycle of ensuring that, you meet your deadlines. That means you may not have time to delve deeper into some of these stories and some of the issues you're talking about.
You see, I hear that argument very often. There are a lot of issues on which, yes, the media have a resource problem. I understand that. But I don't think this has been the problem this time around. I'm asking these questions not because I have a team of investigative reporters. Frankly, I'm asking these questions because I read the newspapers and I watch television and listen to radio, and I know that it's false to say that you have to have lots of infections, because I know lots of countries in Africa and elsewhere that haven't had lots of infections. So to me, it's not a skills issue. One of the ironies of the situation is, a lot of people say, well, it's not, you've got this professionalization problem in journalism. Journalism is battling for resources, etc. We have in this country a specialized institute which does health journalism, and they haven't been asking the critical questions. And these people are specialists in health journalism. So my argument is that this is not about resources. There are other things which are about resources. This is about a particular attitude, and the attitude seems to be one that A, scientists are always right, and B, if governments tell us that they're listening to scientists, then the governments must be right. You don't need a huge newsroom to have a different attitude. It's not about the stories we dig up at this stage. It's about the questions which are being asked.
And looking at, just the coverage of some of the, the numbers, the death toll and all of that, what would you say are some of the missing voices that, the media may have missed in telling the story?
You see, I think that the handling of the numbers has been a problem to a certain extent. Very often what you get is a set of numbers on the screen. Sometimes you are told what the numbers were yesterday. Sometimes you're not. Now, this is absolutely crucial. What we should be told with the numbers is on every given day whether the infection rate and the death rate is going up or down, and how it compares to the last few days. Because unless you can see how it compares to the last few days, the whole thing is meaningless. One of the problems we've had in this country, and the reason why we are in the difficulties we are, is that if you speak around the world to people, they will tell you, including the World Health Organization, that what you should be doing is lifting restrictions when your infection rate goes down. You don't lift restrictions when your infection rate goes up. Now, our problem is that very often we don't know whether it's going up or it's going down. Obviously, you see a number on a screen, a broadcaster or whatever the case may be says to you, well, we have 10,000 more cases. And obviously that's newsworthy. But how many cases did we have yesterday? If we had 14,000 cases yesterday, then things are getting better. If we had 8,000 cases yesterday, then things are getting worse. And I think it's that kind of reporting which has been missing. So yes, we know on any given day how many people have passed away and how many people have got ill. But we don't know whether, simply by looking at the figures, we don't know whether things are getting better or worse.
And do you think then that there is somewhat of a reinventing that needs to happen in the media space?
Yes, I do. I think that unfortunately part of the problem, there's several things I think which need to be rethought in the media. First of all, I think that people really need to look at, is there not a sense among media people that you can never question scientists? Because you're not a scientist, I'm not a scientist, and therefore they must know what they're talking about. I don't think that that's good journalism. I don't think it's accurate anyway. If a scientist wants to talk in public, they should be able to defend what they say. And you should be able to say, but excuse me, you've just made the statement, and I happen to know from my reading that what is happening elsewhere in Africa doesn't confirm that statement. Could you please explain what you mean? Nobody has asked ever, that I'm aware, how can you say that it is inevitable? And yet the president, whenever he goes on television, says, you see, our scientists are very clever. They told us that infections would rise. I don't think a family who's got loved ones in hospital is going to be comforted by the fact that the scientists told us that this was a good idea. So that's the first thing. I don't think anybody who appears in the public space is beyond questioning. Everybody should be questioned. I think, secondly, there has to be far more emphasis on getting out of a rut. The problem with the way in which news has been covered in this country, particularly over the last few years, is that people are used to doing it in a particular way. So yes, corruption is a huge problem in South Africa, but there's been, in the last few days, there's been far more attention on corruption than there has been on why people are getting sick and dying. And it's not an either or. We need to cover corruption. But if you're only asking about corruption and we're not asking why people are sick and dying, then I think that we're letting the people of South Africa down to a certain extent. You don't need to be a medical expert to ask those sorts of questions. And thirdly, I think there is a need to say, I think we need to do far more thinking of what is it that people need to know. People need to know whether this disease can be beaten. They need to know how it can be beaten. They need to know whether the hospitals are serving us in the way that they should. Because if they do know those things and they don't like what's going on, then they can do what people do in a democracy, and they can say, please, we want this to change. We want things to be different. So I think it's not just about whether one covers the news accurately, or that's important. It's also, do you empower citizens to make sure that they can ensure that the government they elect serves them? And I think that if we start thinking along those sorts of lines, then I think conversations can open up and we can have a much more effective journalism, which will actually empower South Africans to deal with this dreadful situation we find ourselves in.
It sounds like, Professor Friedman, there you're suggesting that there should also be an interest test here when it comes to media houses' discussions, particularly at editorial level. Are you then suggesting that there needs to be vigorous debate when it comes to, especially because you're looking at an issue of corruption? It is going to grab headlines. It is the stories, especially as we're looking at the tender corruption around PPE. And then you juxtapose that versus with the number of people that are dying. Are you then saying that there needs to be more vigorous debate to ensure that we're not chasing deadlines and we're digging deeper, and in some instances not running with the latest developments at that particular time?
Yes, I do. You see, I don't want to create the impression that I think that you shouldn't cover. Of course you should cover corruption. It's a major issue. People are being abused, and that is not acceptable. What I'm saying is that the same kind of vigor and the same kind of energy that gets put into covering corruption should be put into asking the questions I've mentioned, should be put into challenging the medical scientists to explain what they mean, should be put into challenging the health ministry to say, why isn't testing and tracing working? Why do we have 10,000 infections a day when Rwanda's only had 1,500 in 6 months or 4 months, or whatever the case may be? The same sort of energy should be going into asking the hospitals, are people getting better? Are you being able to treat people in a way which sends them home to their families in safety? So I'm not saying it's an either or. Of course corruption must be covered. I'm saying that we're so used to covering corruption in this country, it's been such a major issue, that I think it's a sort of comfort zone in effect. Everybody knows how to cover corruption, etc., but not enough attention goes into these equally important questions of holding powerful people to account to ensure that they're serving the health of the citizens of South Africa in the way that they should.